Dr. Maglorie, welcome to Love Notes for Dummies podcast.
Thank you, ma'am. Thank you.
So glad to have you.
Thank you.
Amazing. So listen, I hear you grew up in Brooklyn?
Queens.
Okay, Queens, New York, correct?
Yes.
Now, every time I think about New York, I just think of such a, and although I've been there several times,
Right.
It's just a busy place.
It is. People are very focused.
Yeah.
Very ambitious.
Oh, yeah.
They're just all about whatever they're doing. Mm-hmm. Very different from Miami.
Yeah, I can see that. So how did you wind up here?
I came here after medical school and residency. So I trained at Howard University, College of Medicine. That's where I graduated.
Okay.
And I completed my residency at Boston Medical Center in Boston. And then I won a scholarship, which is a National Health Service Scholarship.
Okay.
Very similar to like an Army Corps.
Yeah.
It's a scholarship program where they put you in areas of underserved populations. So actually I started in Liberty City.
Oh,
Yes.
really? Okay.
So I worked in Liberty City for about 7 years, and after that, I started my own practice.
Okay.
I've been working in the North Miami Beach area since about 2010.
Right. Okay. And working in I guess I would say underprivileged area for the most part. How was that for you? How was working?
It's very rewarding. It's challenging, but very rewarding.
Yes.
Because you're working with a population that actually really needs your help.
Yes.
And when you get the phone calls, they're not just bored or looking for attention.
Right.
They're real. As a matter of fact, they don't call enough.
Yeah, okay. Yeah.
It's the ones that are silent that actually are the ones that suffer the most.
Wow.
Right. So I always loved working, and I continued in that work. North Miami Beach is not necessarily an affluent area. My office is extremely focus and strategy. The way I chose my office there to be in terms of strategy. So those from affluent backgrounds have access to me.
Right.
Bal Harbor, Sunny Isles.
Yes.
And then at the same time, I still have held a good number of my clients from Liberty City. And then I'm Haitian descent.
Yes.
So we have a wonderful North Miami Beach, North Miami population.
Oh yeah, North Miami Beach, amazing. And it's interesting you said that, working in the areas where it's not so privileged for the most part, because even when I used to teach, I wanted to work in areas where it was like in the city, inner city. I just loved working with those students. You understand? I mean, it was rewarding for me. And not only that, they absolutely loved me. Although I was a tough teacher, but they really did love me because they appreciated what they were learning. So I totally agree with you on that. Now, I know that when you were in Queen, were you married there or?
No, I got married here actually in Miami.
In Miami, okay. But currently you're not married.
No, I am divorced. Happily divorced.
Oh, happily divorced. Okay. That's
you get divorced for a reason. You I mean, for myself anyway. I shouldn't generalize it.
Yeah.
But I think when we seek happiness, it's nice if you can have a partner.
Absolutely.
I would love to be partner. I love being married.
Yes.
I just didn't like the person I married, right? And so, in order to seek happiness, I felt the best thing for my children, for myself, was to be divorced.
I love that. And you know what? Because that shows me self-love. You know, it's not a situation that you stayed in a relationship just because you have so many women that do that. And I just feel that's not even good for your health.
Right.
Being in a situation with a guy, a man, and you're just unhappy every day.
You'd be surprised that people don't understand emotions then seep into your body.
Yes.
I was in so much pain.
Oh, yes.
I had a lot of pain. I had a lot of this weird back pain. I went to a chiropractor. I went to holistic doctors, oriental medicine. I did everything.
Yeah.
And then once I got divorced, you know what? That pain is gone.
All of it was gone. Stress. Nothing but stress, anxiety, all of that.
It was really good. So it's somaticized.
Yes.
Yeah.
Good for you. And you have 2 children.
Yes.
13 and 18.
Yes.
That's a gap.
Yeah. And they're driving me crazy.
I can imagine. Yeah. But they don't live here.
Well, my daughter's here.
Yeah, your daughter's here.
Yeah, she's graduating Monday, high school.
Oh, good
yeah,
for her.
It was my first. She was actually a C-section. And then my second was actually a VBAC, something called vaginal birth at cesarean.
Oh,
and I actually delivered him at home.
Really?
Yes.
No pain meds or anything?
No pain meds.
You went through all of that? Oh, wow.
I wanted to make certain, again, and since we're talking about healthcare.
Yes.
To be honest with you, even as a physician, I did not trust my healthcare providers.
Really?
And in terms of when you look at the Black maternal health crises, so much of it is leveled on mistrust and really someone not hearing you.
Okay.
And I felt that happened in my first pregnancy, and which why I ended up with a C-section. Why is it that those physicians didn't believe in birth? Why wouldn't they just allow me to go into labor? You know, and I shouldn't have to work. You know, I like escaped, I disappeared, you know, just to avoid being induced. Meanwhile, it's okay just to let your body say when it's time.
Say when it's time.
So here I am being like pressured by them to come in, and I just gave in, and of course it was a disaster. Ended up with a C-section. My daughter was very, you know, she had what they call deceleration. Her heart rate was unstable. So of course I said, just get the baby out at that point. So my second one, I said, you know what? Whenever he comes, when he's gonna come. Right.
And you didn't do any of it?
No, I just stayed away from them. And I just allowed the baby to come when he did. And I did have a midwife. You know, it's not like I was like rogue on my own. Yeah. No, I did have a midwife, but I was also seeing a physician on the at the same time. And I allowed him to come naturally, which he did.
Amazing. I love that. I love that. So listen, you know, anytime I think of GYN, gynecologist, I always say to myself, I imagine myself having to look at vaginas every single day. Now, I must ask you, what inspired you to do the work that you do today?
Well, my mom was a midwife in Haiti.
Oh, okay.
Yes.
Okay.
So, and as Haitians, they do a very good job with brainwashing us as children. We really don't have a choice as to the careers we go into. You know, there's like doctor, lawyer, engineer, doctor, lawyer, engineer, and of course nurse, doctor, lawyer. So guess what? She has 4 children. One's a doctor, one's a lawyer, one's an engineer, and one's a nurse.
Wow. Isn't that something?
So
really?
Funny. Yeah. So, you know, just hearing her stories of maternal health and taking care of women in Haiti, it inspired me. She was a woman of education, books. She would just put books in front of us. And I remember we had an encyclopedia, and one of them was just showing the gestational ages, and I was just fascinated by just seeing how a fetus grows and embryo, and I just was fascinated. So I remember always wanted to be a physician, always wanted to be a doctor, just always. I just, at one time, I just wasn't sure if I wanted to be a pediatrician versus an obstetrician, because I just loved children. Wow. But then I learned in pediatrics, it's not really the kids you're working with, it's the parents. So I said, you know what, you know, that interaction, you know, they can't talk, you know, so you can do what you can.
Right.
And then, but I'm very procedure oriented. You know, I like doing, you know, rather than talking all day. And that's what made me go into obstetrics.
Okay. And I'm assuming that you absolutely love it.
I do. I still love it. It's changed. It is, you know, it's evolved over the years. I'm not doing the same type of medicine when I started, but it is, you know, still something that I don't regret. Though sometimes I think about I should have done anesthesiology, but the relationship that you foster in that field is something you can't get from a short-term sort of specialty.
Just out of curiosity, your friends, how would they describe you in 3 words?
3 words. I would say loyal.
Oh, okay.
Yeah, definitely very loyal, compassionate, and real.
I like that. I like that. Oh, me and you, real. I love that. Absolutely.
Yeah.
So what is a typical day like in your world? I'm just curious to know. When you wake up, what does your day entail?
Yeah, so I'm usually up actually about 4 or 5 o'clock in the morning. I'm a terrible sleeper.
Really?
So I tend to always wake up at about 4 o'clock. I start already looking at my emails and just doing business from bed. I usually get my daughter up, my son, wherever I am, to get them ready for school, because they usually have to get out by 6:37. And that's my day continues. I'm in my office, I'm seeing patients all day. You know, I try to go to the gym when I can. I usually try to go in the morning. And then, you know, taking care of dinner, trying to have somewhat of a social life.
Yeah. So your day, you would say your day probably end, what, like 5, 6, 7?
You mean the office?
Yes.
You know, when you have your own practice, sometimes I'm there till 10 p.m., midnight.
Wow.
You have to make sure your notes are done, your billing.
Yeah.
A lot of that back office administrative things. It's like having another child in itself.
Would you consider it to be a stressful career?
Oh, yeah. Medicine is stressful.
Yeah.
On a very basic, like, foundation, it simmers. That stress is simmers, right? Every patient you touch, everyone that you engage with, you're trying to make certain that everyone has a great outcome. And then, unfortunately, there are times that there aren't good outcomes. And I always tell everyone, I'm not the Holy One, right? I'm not God, but we just do the best that we can.
Absolutely.
But having that responsibility on your head, you feel the toll.
I can imagine.
You feel the toll.
So if you was not doing what you're doing today, what other career would you be?
Probably entertainment. For sure.
Entertainment?
Entertainment,
really?
I was a dancer in a past life, right?
Really?
So yeah, I was a dancer, and back when they were doing videos and things like that, I was dancing back then. I think I probably would have gone into, as time evolved, into production, and, become executive producer, maybe in films or promotions, anything like that. I think. I love that.
So do you still doing the dancing?
Sometimes I used to. Yeah, I was in a couple of companies here.
Oh, really? Okay.
I was with a Haitian dance company here, as well as African dance company.
Oh, you was?
Yeah, Delu African Dance Company. They have like Sunday classes in Little Haiti every Sunday, and I usually use that as a great stress reliever. Many times no one even knows I'm a doctor. I don't let them know.
Right.
It's not like I'm a doctor.
Right.
I'm just here taking a class
and enjoying yourself,
taking care of myself.
And the thing about dancing, it's a very good exercise.
Oh, it's wonderful.
I mean, because I love dancing. I can't dance, but I love to dance. In my mind, I could dance. Right. Whatever. And like I said, it's a great exercise.
Right.
Okay, so let me ask you.
Yeah.
How important is it for women to get their GYN checkups, especially women that are in their 20s and 30s? How important is that for women?
It's extremely important. I think, unfortunately, women put themselves in the back burner, especially when we're moms, and especially women of color. We tend to be the point A. When I say point A, that means we're the big sisters. We are the best friends. We are the daughters. We are the aunties. We're taking care of everyone, but we tend not to take care of ourselves. And usually in the 20s and 30s, that's when you become engaged in sexual activity usually. And that's the only way really you're going to find out if you have any issues, any diseases, any unfortunate cancer precursors. The importance of doing pap smears and pelvic exams, which is not necessarily the same.
Right. Okay.
Is very important.
Yeah. And and this is why I wanted you to come on, because women need to understand that in your 20s, 30s, women overall, but 20s, 30s, you definitely need to be going to the GYN to just see what's going on with your body. So I like to definitely have those discussions, because I just feel it's important that everyone should know for the most part. Now, birth control.
Yes.
Now, I've heard before that birth control can, impact your sex drive, your relationships, your moods. Would you say that's possible with birth control?
Yeah, I do. I do see this, especially in women who I consider to be very sensitive.
Okay.
So a woman who I say to be sensitive, a woman that already may have some mood or label disorder. Or the women who have anxiety, the women who have depression. Those medications do definitely impact their hormonal levels. But birth control is necessary in terms of family planning. As I always say, every birth takes 2 to 3 years out of a woman's life.
Oh,
right. So as the woman, usually those women, not everyone could be a Kardashian, right, and have 6 kids and be rich, right?
Exactly.
It usually will limit a woman education-wise.
Oh yeah.
As well as financial, right? Especially now, especially people of color, education ties into your finances.
Absolutely.
We're not independently wealthy as a society,
as a community,
as a
definitely.
mass. So. Yeah, birth control is necessary in that regard. But I always say birth control is based on your lifestyle, right? So there's something for everyone. You have something that's hormones. You have some that are non-hormonal. It's just important that you just use one. Unless you make the personal choice to say, okay, I'm not going to use anything. Right. And that's fine. But of course, in the state of Florida, if you see abortion as a birth control, which it is not, you only have up to 6 weeks. So it's best thing is to be on something.
Yes, absolutely. Okay, so what do you wish all women would know? Okay, especially like I said, our women in their 20s and 30s. Right. What is one thing you wish that all women would know before they start being sexually active?
I think number one, I think they need to know themselves.
Oh yeah.
Right?
Oh yeah.
I think they need to be empowered.
Absolutely.
They have to have that self-strength. Engaging in intimacy with someone, you really have to be able to advocate for yourself.
Oh yeah.
Because the sexual activity is not necessarily one-sided. It shouldn't be one-sided. You should be there to have pleasure, and you should be able to voice that. Yeah. So I think that's number one, that women have that. You would be surprised how many clients I have still in their 30s that still have never had an orgasm.
Wow.
Yes, and that's usually because they have not gone through that process of understanding how their body works, and maybe they may not have had a partner that was interested, or had the patience to help them get to that
reach
point.
There, right?
You'd be surprised how many men kind of gaslight women and also cause them to think that there's something wrong with them because they can have an orgasm in 2 minutes, and meanwhile women average is 15 to 20 minutes.
Absolutely.
That's normal.
Yes.
So it's really important that women learn themselves first.
Yeah, and it's no fun when a woman is not getting an orgasm.
No, it's
no fun.
It's terrible. It's a crime.
Right. Exactly. It's no fun watching him get an orgasm and you don't get one.
It's a crime.
That's
so I'm always I'm very when I have my annual examinations with my clients, I go into a very deep sexual history just to make sure that no one's suffering in silence.
Yeah.
That they really understand everything, and also not being taken advantage of.
Exactly. Absolutely. Yeah. Exactly. So let me ask you, what are some of the most common sexual health issues that young women overlook or ignore?
I think the biggest ones are, I would say, urinary tract infections, because it's very common, but guess what? When they start feeling the symptoms, they're going to come in, right?
Yes.
Vaginitis is one that I think, yes, if you have, for instance, candidiasis or yeast infection, right, the symptoms, again, is going to pull them to come in.
Yes.
BV, or bacterial vaginosis, where you have a shift in the pH in the vagina, can cause women, because it's very subtle sometimes, that they may think, well, this is normal for me. No, I'm supposed to smell like this, I guess. Yeah. Or the partner also, again, maybe they make them feel bad about what's going on, what they're feeling. Yeah. And again, that might prompt them to come in. But for instance, they call it fishy odor. Yeah. That's not normal. Yeah. Right. And so unfortunately, someone will have it for a long time and not realize that there is an infection there. Yeah. And I remember telling this guy that, as a matter of fact, because he was, sharing with me, he was being intimate with a young lady, and he was asking me a question like, why was she so unfresh? Right,
that's a word.
Like a pungent odor.
It was like a really offensive odor. So he was asking that, and my first response to him, although I'm not a GYN, but I know for a fact, as a woman, you should not be smelling a certain way. Okay, if you're having a scent that is extra loud, that means you need to go get checked out because evidently you have some type of infection. But believe it or not, you have some women really think that that's normal. You know what I'm saying? Because maybe no one has educated them, or maybe they're not going to the GYN the way that they're supposed to. So they walk around here thinking that, oh, that's just how we smell sometime, and I'm just going to wash myself and I'll be fine. And then, of course, that's not going to do it. You need to go to the GYN. So, I feel exactly what you're saying, because, some women, like you say, they ignore that.
Yeah. And also women, don't get me wrong, also have an odor is on a spectrum. Yes. Right? You have some women who really have no scent, some women who are a little on what they call musky. Right, musky. And that's fine. That's normal too. Right. And it's just that once it starts, that pH really starts to go basic, and you start to get that fish-like odor. That usually is infection. Right. And the only way it's going to go away, for the most part, is with medication. With medication, exactly. Like you can kind of do somewhat of a cleansing, but really, like, the fastest, quickest, best way is medication. Now, we unfortunately have women who have chronic BV, chronic vaginitis. Those women needs to be what they called cultured. That means they need to take a specimen, send it to the lab, and really figure out which medication works. Right. Because many times, physicians just throw medications at the person, and then yet they come back. Yeah. Right? And they have the same symptoms all over again, and also they have to look at their practices. Yes, right? Yes. So that means before and after sexual activity, You need to clean yourself. He needs to clean himself, right? And then also urination before and after sexual activity, because that will decrease on vaginitis, that will decrease on the urinary tract infection. Urinary tract infection is considered to be a sexually transmitted infection.
Wow.
Yes. Now, of course, not for everyone.
Right.
But many times the woman will maybe have a new partner or decide not to use a condom with that person, and then they start to have these symptoms of burning, lower abdominal pain, urinary tract infection.
Yeah. But can't women, like, when they're with a partner, right? Can't women, like, get infections, especially if they're with a partner who is not loyal? Like, for example, they claim that this is their boyfriend or husband, maybe, and he's out there doing other things, and then he brings that back home.
Yes.
I mean, women can actually get infections from that.
Oh, yeah, it's a telltale sign.
Yeah, exactly.
Yeah. Because I will have a patient come in all of a sudden with no infection. And I say, okay, what is, again, I ask sexual history, how many partners do you have? I've only had one partner. Or I've only had this partner for the last 2 years. I said, now I'm not here to destroy anyone's relationship.
No, it has nothing to do with that. We keep it real here, Dr. Maglorie. We keep it real.
But I do also help them to understand that getting a new infection is a polymicrobial event. So what does that mean? That means this person picked up something from another person and then brought it to you.
Yes.
You need to analyze your situation. If you want to test it, let's treat you. You want to use condoms for a couple of weeks and let's see what happens.
Yes, exactly. And that's why, I tell women, you need to be very, very, it's very, very important that you are in committed relationships. All of the situationships these women are in, and or these friendships, with benefits, that type of thing. You are subjecting yourself to so much, as far as diseases, infections, etc. You understand? So, I just think this is a very important conversation because I really think that some women really don't understand, what can happen when you have someone that is out there, fooling around.
Exactly. I think it's more so also this generation has not been, I'm talking about HIV/AIDS. They haven't seen it. They don't know it.
Yeah.
For the most part, we have done such a great job, miracle drugs, in treating HIV that people aren't really dying anymore.
Right? Exactly.
It's now a chronic illness.
Yeah.
But unfortunately, you still have something called HPV. Even though we still have the vaccine, women are still dying of cervical cancer. Women are still being diagnosed very young in their 20s and 30s. And HPV is a sexually transmitted disease. It's a virus.
Yeah.
And the only way you can protect yourself from that is using condoms. And going to the doctor regularly to make sure if you get HPV. HPV is very common, especially between the ages of 20 to 30. As a matter of fact, because of that, we don't even test for HPV because we know it's so common. It's only if the patient becomes back abnormal will we then have a reflex to see if the person has HPV.
Okay.
So all women technically over the age of 30, they should make certain when they go to their physician, their OBGYN, their primary, whoever does their pap smears, that HPV is included in that testing. You would be surprised how many doctors are still not doing automatic HPV testing in women over 30.
Wow.
Because that's when the incidence of cervical cancer really rises, right?
Oh, okay.
But you still have, unfortunately, I have one 27-year-old diagnosed with, stage 2.
Wow.
Yeah.
So early.
Very early.
Yeah.
Very aggressive.
Yeah,
very
it's very,
aggressive.
yeah.
Very aggressive. So that's why you have to go to the doctor regularly. So, some women are asking, what about the every 3 years? And that's true, right? There is a lot of information stating that you can do a pap smear every 3 years or every 5 years. I tell them, you know what? Don't participate in that chicanery.
No, that's not happening.
You need to know for yourself, and to make sure if you're in a committed relationship, you two are monogamous, and you've had 3 pap smears in a row every year and they're all negative, then you can consider doing that. But if you've ever had HPV in your life, you should never go.
Never.
More than I would say, because I've seen it.
Yeah, you've seen it all. Exactly.
The studies, remember, don't necessarily focus on women of color. And unfortunately, we tend to have more aggressive, which ones? Breast cancer, uterine cancer, and cervical cancer.
So how often would you say that a woman, like me personally, I'm at the GYN literally once a year. Right. That's regardless my primary care, dental, everything is once a year for the most part. No, except dental is every 6 months. But but like GYN, my healthcare GYN is once a year, but my physician, I do that like every 6 months. That's what I do. But how often would you say a woman needs to make sure that she's at the GYN?
Yeah, I would say definitely every year.
Yes.
I would say once sexual activity begins or 21.
Yes. Okay.
So even if you are not sexually active at the age of 20, you should start going to a gynecologist.
Okay.
Definitely sexual transmitted infection checkups can be done at any time.
Yeah.
Tell me you did your pap smear and then maybe 3 months later you're saying, oh, I have this weird discharge. I'm just a little concerned, or maybe I had sex without a condom. She's like, yes, go in and be tested. We still haven't gotten to the point where, you know, I mean, there are some services that are doing at-home testing.
Yeah.
You know, yes, you can go to like STD Now and these places. But in the end, I always recommend people to come in, you know, because sometimes you may have something like herpes that needs to be usually visualized. And the best way is really in an office.
So discharge, are there certain types of discharge?
Yeah, I mean some are more pathognomonic, you know, for whatever it is. For instance, a yeast infection has a discharge usually. It's usually whitish or yellowish. It's usually clumpy, thick. And
is that like cottage cheese?
Yeah, that's what they call it. The BV usually is watery, grayish. Again, the odor is the biggest one, but also irritation. Someone will also say they have irritation when they have BV. Those are the two biggest ones. Right. Chlamydia. Most people don't know they have chlamydia.
Really? Well, what are the symptoms for that?
Yeah, that one, number one, none.
Really?
Number one, none. Number two, yellowish discharge.
Okay.
You know, for instance, you know, when I'm examining a patient, usually when I notice this purulent discharge, especially from the cervix, you know, it look like pus.
Ooh.
Yeah, that's usually gonorrhea. Chlamydia would be yellowish, you know, and then sometimes, as I mentioned, sometimes we don't necessarily can tell.
Right.
You know, but, you know, in my office, I test everyone for STDs. It's no judgment.
Oh, that's good.
No judgment.
That's good.
Unless a patient specifically states not to be tested. But I test everyone. Yeah, everyone.
So, I mean, in your field, do you experience or do you come across that often with women having situations like that, gonorrhea, syphilis, and...
Oh, yeah. I mean, sexually transmitted disease is real.
Wow.
You know, and the good thing about pregnancy is it forces a woman to go in to see a doctor.
Oh, yeah.
And that's usually when we start to diagnose those STDs. There's chlamydia at the start of pregnancy. And they didn't even know they had something.
But are you able to clear it up?
Yes, yes, definitely. Chlamydia, syphilis, those things are all treatable. As you know, HIV is a virus, so it's incorporated in DNA, and they will have that. You know, it could be something that could be controlled.
Yeah.
All the viruses kind of function that way. But yeah, most of the infections, yes, we can treat.
Okay, great. Interesting. Okay, so my next question, okay, because I think that people kind of get this a little confused. Now, I've had people say that I only wash with water. Now, I cannot relate to that at all, right? Now, me personally, like I say, I always say like a vaginal wash, or you know, wash that does not, you know, contain any perfume, things like that, you know. But it's no way that I'm to just use water on my vagina. I just never. So I would like to know, what would you recommend as far as women, as far as a vaginal wash? What would be a good vaginal wash?
I mean, what you're hearing in the medical establishments, actually, that's what they state, that women should only clean themselves with water. I totally agree. I don't believe in that either.
Right.
And so, yes, for most of my patients, you know, whether it's something I diagnose or something that they ask, I do recommend a mild soap without perfumes, without dye, something like an ivory.
Yeah.
You can use a mass and gel or these sort of private washes, feminine wash, that's fine. But I would always want to make sure that women know those are not treatments, right? So many times those mass and gel creams and lotions they'll use thinking that they can take care of their itching. No, you probably have a yeast infection. You need medication. Douching, I usually do not recommend, but douching in the right setting is okay. But usually, again, most women don't know if they have an infection or not. So that's why we'll always say never douche.
Right.
But if someone really kind of has an understanding of what's happening, you know, douching is not terrible.
Right.
You know, it's just that most women just usually don't know. So we don't want them putting things in their vagina and squeezing them, you know, squeezing this fluid inside, and then they end up pushing whatever is there into their system. You know, but you know, in some cultures, especially in the Haitian community, where they teach a woman to put their fingers inside the vagina. You don't necessarily have to do that, you know, but it's nothing wrong if you do that, you know. But you know, the vagina is a fresh place technically. You don't really have to. But if someone does it, I don't tell them don't do it.
Don't do it, right. And when a woman's menstruation comes on or whatnot, would you say Tampax are good to use? I mean,
tampons.
Yeah,
No, I mean, with
Tampax,
with the company.
Would you say those are good to use?
I mean, they are safe to use when they're used according to the directions. So,
right.
I mean, each company, like Tampax, and some of the other companies will say 6 hours, some will say 8 hours, some will say 12 hours.
Yeah.
I think it's important. And they are new products on the market.
Okay.
You have these cups, you have this, you have that.
Yeah.
I think it's very important that women read the directions.
Yeah.
Because all these devices had some sort of study. And that's when we were able to kind of see when toxic shock syndrome, TSS, that's what's associated with tampons, right?
Right.
So the problem with the tampons are that women forget.
Oh, okay.
Right? Sometimes they forget it's there, or they forget one there, then put another one in there. Yeah, and in my career, I have, unfortunately, one woman did die from a prolonged, she was a young girl that she maybe, I guess, forgot the tampon was there and ended up going to ICU. They couldn't figure it out, and finally they realized it was a tampon. She was in septic shock and died.
Oh my goodness!
Yeah.
Wow.
She had toxic shock syndrome. So I think women can use them, but they just have to use it judiciously and really make certain that they using it the way they're supposed to use it.
Okay.
Now I can't go to sleep with the tampon.
Right.
It has to come out.
Exactly. How do you forget that? I don't get it.
It has to come out.
Whatever. Okay. So, what is one piece of advice you would give every woman when it comes to prioritizing their health and their relationship?
I think in the end, women have to understand if there is no you, there's nothing else, right? We have to always put ourselves first, and especially in a relationship setting, making certain that our needs are met. Because the only time when you're happy, then everyone else is happy.
Absolutely.
Right? Your children are happy. Your partner is happy. What they say, happy life, happy wife, happy life.
Yeah.
And the woman is the center.
Yes.
The cornerstone, and it's really important that we are giving ourselves that. We allow ourselves that time to go and take care of ourselves, and that's why, for instance, in my office, we do so many of the appointments for the patients. Because I know as soon as they walk out that door, ding, the phone starts ringing. Mommy, baby, can you pick up some juice? Can you pick the eggs? They don't remember anything that I just gave them in terms of instructions.
Yeah.
So we really try our best to kind of take care of them while they're in the office, because we know, mammograms, everything, colonoscopy. We just say, listen, we make the appointments, or we say exactly where to go. And if we have an offender that, we sent them 2 times, they still haven't made an appointment, we just do it ourselves, because it's just too much.
Yeah, I love that.
Yeah.
Dr. Magloire, this was amazing.
Thank you. You
I'm
too.
so happy that you came and sat in my chair at the Love Notes for Dummies podcast.
Thank you.
I think that my ladies are going to be very informed after this feature, because I just feel that, this is information for all women. You understand? And I think it's solid information. It's important information, because women really do need to understand the importance of going to get their annual checkups.
And I appreciate you coming with this format and educating the women, because I don't think we hear it enough.
Right, I agree.
There aren't enough positive voices that allow us to say, okay, let me take care of myself.
Absolutely.
And I am worth it.
Absolutely.
I appreciate you really lifting this up.
Thank you so much. Thank you for coming.
No, thank you.
All right, thank you.
Talk about it.